Mr. Ahmed, from what you told me, I'm from checking you. I think you have something that's called cervical spondylosis. You have any idea about it? No, doctor, that's a weird name for me. Mr. Ahmed, this is cervical spondylosis. It's age-related wear and tear, affecting the bones in your back of neck. There are two types of bones. It's called the vertebra and the discs. The disc act like a cushion between the vertebra. By time, the disc undergoes shrinkage and bulges out. In most people, this doesn't cause any symptoms, but in some people, it causes symptoms. The management mainly depends on neck extension and maintain activity and give you painkiller for pain. Is this clear to you? Yes, doctor. Mr. Ahmed, I understand that you want to do X-ray for your neck to see what's going on, but from your symptoms, you don't have any weakness in your hands, you don't have any numbness, you don't have any history of injury to your neck, so X-ray will not help us much at the time being. Is this clear? Yes, doctor, it's clear. So what I will do, doctor? First of all, I'd like you to take some painkillers, okay? Like for example, paracetamol and codeine. You can take it whenever you feel pain, okay? And also I advise you to sleep on firm mattress, okay, and firm pillow, okay, and try to maintain your neck activity. This by time is expecting to make you feel better about this pain, okay? Okay, doctor. If this pain persists for more than 4 weeks, we have other options. Maybe we can think about it, like for example, physiotherapy, like acupuncture, like giving you drugs for the pain that's more stronger than this paracetamol and codeine. But for now, how about trying these measures that we agreed upon, like taking this painkiller and try to maintain activity, and we see if this improves, okay? Okay, doctor. Mr. Ahmed, if you ever feel any pain or numbness or weakness in your arms or shoulders or hands, you can come back to me at any time. At that time, we can consider to do some imaging to your neck, okay? Okay, doctor. And if you have any question, you can call me at any time, okay? Okay, doctor.